Okay, so yes, so we're talking about tuberculosis spondylitis, and so we're about coming to an end to our presentation. So we're looking at some pictures that will give us a very brief understanding of this condition. So we can see the curve there. So we have the collapse of the lower back. This is an MRI showing the collapse of the the, the, the back. Yes, so these are our pictures that shows that the person has spinal tuberculosis. So you can see this is a very good picture. You can see this picture here, the vertebrae, that's the bones here. These bones are called vertebrae. So 1, 2, 3, these are all bones here, and they're called vertebrae. So I was mentioning vertebrae. So this is called the vertebrae. This. So you can see the picture, the circling here. You can see the yellow circling here. That shows where we have the collapsed bones. Yes, so we have, so when these bones collapse, they push the bones, the upper back forward, and when the upper back shifts forward, it could cause a collapse in this structure called the vertebrae, and it could cause spinal tuberculosis or tuberculosis spondylitis or pulse disease. And this collapse can be as a result of also infection. So the infections can reduce the strength of the bones and could cause them to collapse. Okay, so this is a CT scan, this is an MRI. So you can see this region here, the hole here. After some time, it can collapse and could cause the bones to shift backwards and could cause the upper curvature of the back. So this is someone having the condition called pulse disease. You can see the small bump at the back. So when we palpate or put our hand there, it could cause tenderness there. And this is also an X-ray showing the collapsing of the vertebrae. You can see it here. You can see this is the vertebrae. And mostly this condition occurs actually by collapsing the anterior side, that is the bones in front. The back mostly are not affected. It occurs mainly at the front part of the bones, either at the mid back or the upper back. Very little cases are affected by the lower back. And so this also an MRI of the back. You can see this structure here. You can see the spinal cord has been tampered with, have been pushed. This structure, this is called the spinal cord. This whole thing is spinal cord, and this is called the intervertebral disc. So this is the bone. Bone has been collapsed or broken, so it pushes the spinal cord and impinges upon it. So this is also the bone here. So when the bone collapses, it pushes the spinal cord backwards and then causes distraction and can cause paralysis. It can cause bowel problem. You can have difficulty or urinary complications. So this is actually what I was talking about. So far, I'm sure now the picture is very clear. So this small boy has what we call the tuberculosis spondylitis, or the spinal tuberculosis, or the pulse disease. So you can say the person has a hunchback, but then when we delve more medically, the person has spinal tuberculosis. Okay, so these are all X-rays. So this is a surgical procedure. So the surgeon goes to spinal stabilization surgical procedure to collapse the vertebrae and strengthen them or straighten them, and this could result in the normalization of the body structure, so the person is able to stand well. So if this child goes to surgery, there's other surgical procedures that will be carried out to take off all this and then strengthen or straighten the spine. When this is reported very late, there's very little to do, and so we try to manage the condition as such. So these are the roles I was talking about. So it holds the spine in place and helps to prevent exaggerated curvature of the spine, which could be a complication. So how we diagnose this condition, we can have, as we mentioned, we can call the medical laboratory scientists to do tests to diagnose this condition. So this is a small boy also having this condition called tuberculosis spondylitis. So you can see the curve here. I'm sure we can appreciate it more with this presentation. So this MRI showing this condition. So you can see the curve at the upper back here, pushing hard here. So you can see it here. Okay, this is also another one, the same guy, and this is also another one. This is actually a pictorial presentation, and also so the person can have too much curve at the upper back, and could also have too much curve at that is shaped curve at the sideways. Okay, so it's also an MRI. Okay, so these are all presentations. Okay. All right. So this brings us to the end of today's presentation. I'm sure we've learned a lot. There were interruptions, the network issues, but thank God we've learned a lot from today's presentation. Okay, so without much ado, we come to the end of our discussion. I'm sure we learned a lot. There are others who join in, network issues, they run out. But I thank God we have a full or combined presentation. That is, we combine all the interruptions and then we'll put on YouTube, and just stay tuned and watch our Facebook page, and then we'll give you a full video of this presentation. Okay, so thank you very much for this evening. Before we leave, we'll mention our next topic, and I'm sure we'll have to see the flyers as they come by. And so our next topic is actually a very nice condition. Yes, I'm sure we'll learn a lot from that condition too. It's called avascular necrosis. Avascular necrosis. And so let's tune in this Sunday as we talk about this condition called avascular necrosis. This Sunday. Thank you very much. Have a blessed evening. May the good Lord be with us all. Bye.